Okay, so this was a patient that had a vitreous hemorrhage and a dislocated IOL. The IOL dislocated through a posterior capsular rupture, and in an attempted to float this up, there was an accidental penetration of the retina. Don't advise cataract surgeons to go digging back after lenses, but this was an excellent cataract surgeon that had this happen to him. But you can always think we can almost get it. The big key here is making sure you've got the vitreous separated. This can be a real disaster if you don't have a full posterior vitreous separation. And so you can see the lens here. It is kind of bouncing around. These lenses can bounce around and really don't cause any harm to the macula. They just kind of tend to float. And we're going to go ahead and just ignore that lens for right now, do our core vitrectomy, taking care to really shave and get absolutely every bit of vitreous off from around that puncture site where we can see there was a little bit of hemorrhaging there. We're going to clear our pathway. So he's got a really nice capsule, good anterior rhexis, make sure there's no vitreous in the way. And then I like to do a soft tip lift where I just lift the IOL off the surface of the retina with the soft tip. I'll go back through the cataract surgeon's wound here and grasp it with like a tooth forceps or a smooth forceps. Get it up there into the anterior chamber, and then I'll cut the lens. And these are really easy then once they're cut to just kind of Pac-Man out, where you just kind of pull the lens out after it's cut in half, and a little gentler on the wound and the endothelium there, kind of rotate it around, and it'll come up very nicely. And then we want to go in after we're done with this, and we're going to leave this patient aphakic. Cataract surgeon went back and put an IOL in their eye. But we want to laser around that retinal defect, and since it's inferior, or any retinal defect for that matter, I'm going to go ahead and put some air in and treat this like a retinal detachment, so eventually I'll actually go to gas. And here we can see really nice result. Thanks for watching.